Welcome to the Phasor Quick Connect Electric and Legacy Manual Drill hands-on demo with the diameter shown on each bit's flat portion. To engage the bit, gently rotate the bit inside the connector, feeling a click. This means it's aligned, not locked in. To lock in, only now pull back the blue sleeves strongly until the bit slides in further, then release sleeves and ensure bit doesn't fall out. Adjust stopper to estimated desired depth, about 2 millimeters more than skull thickness. Hold the stopper with one finger each on the top and bottom parts, preventing rotation during drilling. Holding against skull ensures perpendicularity and avoids an additional retractor. Our Phasor Legacy Manual Drill fits the same quick connect bits as electric ones, allowing customized options or both options, with further choice of drill bit sizes needed for a hospital. The conventional drill stopper can be slid onto the bit and set screw tightened to desired skull thickness. Noting this has been tested to withstand up to 5 pounds weight without plunging. For withstanding up to 50 pounds of downward force, the conventional drill stop can be first placed just distal to the flat bit portion, screw tightened, and the drill stop extension adjusted to correct depth and placed over it onto the skull, with subsequent two-handed manual drilling, ensuring correct depth is maintained.